Peritoneal dialysis is a home-based therapy. It's a different form of dialysis that uses the lining of the belly as a natural filtering system. It is a bloodless system. There are no needles, there's no blood, but what we use is sterile fluid that goes into the belly, washes poisons and excess fluid out, and then that fluid is removed to be replaced by clean fluid once again. Our patients, most of our patients, do it at night while they sleep with a machine called a cycler that automatically puts fluid into the belly and out of the belly. So why did you pick PD?
I chose PD because I still want to go to work, and it's very flexible for my home life. I think the biggest thing was the flexibility and being able to do everything that I normally would do, and it's allowing me to do that.
Michelle, what are the advantages of PD for you?
I feel that, my home life it's good. I'm able to do the things that I would be able to do with my son and my husband, and I'm going to go back to work this week, so I think it's definitely beneficial.
Do you sleep well while you're on PD?
At first it was a little uncomfortable, and I am still kind of getting used to like the fill, because it's like a lot of fluid overnight, but as the night goes on, I'm out. So it's a good thing.
So was it easier for you to learn PD?
PD wasn't hard to learn. My nurse, he went over step by step, and I think with repetition it came easy for me. So,
Michelle, what was it like to get your PD catheter?
First I went through the surgery, and I went and I met with the surgeon, and he basically told me what the procedure would be like and how long, possibly it would take to heal. Then I basically came and I met with Dr. Glickman, and Dr. Glickman, told me what the procedure would entail also once the catheter would be inserted. The catheter approximately would be like 2 weeks to mature before we could use the catheter. And so far, here we are.
As with any of the home dialysis options, patients must be motivated to participate in their own care, as well as be able to observe the strict protocols involved to minimize the risk of infection. Here, the patient describes how she cares for her PD catheter.
I always use a drape. I always have alcohol sanitizer just in case. Expose my catheter. Take down the tape. And I have tape here just to secure the catheter in place. Take off the tape. And before I do anything with the catheter again, I just give myself another squirt there. And then over on this side is where the actual catheter comes out and is inserted into my abdomen area.
Many patients facing the prospect of undergoing home dialysis may be concerned about the impact on their lives in general and their sex lives in particular.
Well, it doesn't inhibit us. We kind of have to plan to find time, since I have to be on the machine for about 8.5 hours. So, we kind of do have to plan when we're going to be intimate.
The flexibility of dialysis is one of its greatest strengths. As you have seen in the preceding segment, there are several types of dialysis, each of which has its own profile of benefits. In-center hemodialysis is preferred by patients who like the security of being in a traditional healthcare setting and the regimentation of being on a strict 3-day-a-week treatment schedule. Home hemodialysis is preferred by more independent patients who like the convenience and comfort of treating themselves in their own homes. There is no need to schedule appointments, and the frequency of dialysis at home approximates the kidney's own natural functioning. It also affords improved blood pressure control, better quality of life, and an improvement in survival over in-center hemodialysis. Nocturnal home hemodialysis affords all the same advantages of standard home hemodialysis, but because it's done at night while the patient sleeps, it allows patients to participate more fully in their daily lives. This leads to a dramatic improvement in the quality of life. Other benefits include better blood pressure control, fewer dietary restrictions, and less need to take blood pressure medications or phosphates. Peritoneal dialysis is another home therapy that can be performed with minimal interruption of the patient's daily routine. It may be an excellent choice for patients who fear the sight of blood or might have trouble sticking themselves with needles. Some patients choose to perform peritoneal dialysis at night using a machine called a cycler. Even though the various forms of dialysis have much to offer, some patients may opt to explore kidney transplantation as the best long-term solution. The next segment of this DVD provides a more in-depth exploration of this surgical option.